she's on something that's working. She's got myeloma that's come back. This doesn't look so bad on this graph because it's normalized to this initial diagnosis. But if you go back 1 year or 3 years, this is coming back. It's, her lambda free light chain was high. Now she's gone through a stem cell transplant to bring that down. And now she's got something that looks like it's working for maintenance. It's once a month infusions. I'd be concerned about about going to the doctor's office. I think the hospital's concern about having her be exposed to sick people and potentially catch COVID-19 is a very legitimate concern. No question about that. And patients with myeloma are already immune suppressed. If she were to get COVID-19, it would be really terrible. So you have to try to avoid that. On the other hand, I think it is also a real issue that she, exactly as she says, she's worked hard to get to this point, and she's knocked the myeloma down. She's keeping her boot on its neck by continuing maintenance therapy. And because this is a myeloma now that's relapsed and she's gone through a stem cell transplant, without maintenance therapy, I'd be quite concerned that it's going to come back again. And like she says, it might seem like an exaggeration to worry about missing it even for a month. But if I were her, I would worry about that. I would want to try to figure out how to stay on this regimen during this trying time. That's what I would want to try to figure out how to do. Now, you could say, okay, I want to switch to something that's oral. There are pills that people could take, one of which might be, she's been on Revlimid. There are other anti-myeloma drugs that are pills, Pomalyst, Ninlaro. And if there were no way to continue daratumumab, then you could say, okay, maybe she could stay on some other kind of maintenance that at least would be maintenance for her, trying to keep her myeloma at bay. But what you don't know about those other drugs is you don't have any idea at this stage of knowing whether or not they're working, whether they would work as well as her daratumumab seems to work now. So in my humble opinion, if I were her, I would try to figure out how to get your daratumumab. And if if the institution where she's seen now doesn't want to do it, I know of other places that are taking infection control very, very seriously. I'm sure the place she is doing that. I mean, obviously they're taking it very seriously by trying to keep every possible patient out of the hospital. But I would wonder, if there might be another place in this area that would be able to accommodate her, maybe just transferring care for a short period of time to a setting that might be where I know they're incredibly serious about infection control. And I think she'd be able to get her ongoing treatment there during this period. If I were her, I would focus very hard on not getting the virus, doing everything she can to avoid getting the virus, but figure out a way to get these infusions.